We retrospectively reviewed the transplant in pediatric non-malignant conditions. There were about 1,246 patients who received transplant, and among those, there were 529 who received transplant for non-malignant disorders. And for those, we looked at the determinants of graft failure in these patients. And we found about 26% of those patients developing graft failure, secondary graft failure. This is a retrospective review that we between 2002 till 2024 in June, and we used univariate and multivariate analysis to determine those determinants of graft failure. And mainly we found that the type of transplant, or the type of conditioning, is very important. For example, the using of reduced intensity transplant was associated more with graft failure, and also those transplants who received no conditioning, such as immune deficiencies. We looked at the stem cell type, and the stem cell type was also one of the predictors of graft failure. So those patients who received peripheral blood and unrelated cord blood stem cells were associated more in our group with graft failure in non-malignant conditions. And also we looked at the stem cell dose, but it was not one of the predicting factors. Those patients who developed graft failure, they had more hospitalization and higher rates of mortality. But this needs to be examined in a prospective review. However, this study will help us refine our transplant conditioning regimens, and also the better selection of the donor and the recipient gender mismatch, which is in our study was found to be one of the predictors also of graft failure. This will hopefully improve the outcome of those transplants.